Okay. So let's go ahead and, if it's all right with everybody, move ahead with the public comments. Does anybody have any public comments? Okay. No public comment? No public comment at all? I forget, did we have any public comment at the combined meeting? Does anybody remember? Anything that we could share with the CAC?
We did not have any public comment at the combined meeting last week.
All right, no public comment. So do we have a quorum then, or no, we still don't, for the meeting minutes to vote?
We have 8 folks here. 1, 2, 3, 4, 5, 6, 7, 8, and with Chris stepping off, I think 8 would make a quorum. Michaela, as if it was 9, and now we're down 1.
Okay. Thanks for figuring that out. In the meantime, I guess we actually need to step back and do introductions. It's kind of rushing forward. Is there somebody who can help with that? I guess that's either Camille or Michaela, or I guess Kelsey's still there. Camille.
Sure, I can do it. Why don't you go ahead, Brad?
Okay, Brad Porterfield, CAC Chair, Health Council Board Member, Latino Community Association Director, Consumer Rep.
Okay, and Teresa, and after that, Carolyn.
Teresa Olander, Community Representative on the CAC.
Carolyn Black, I'm with the State of Oregon's Oregon Health Insurance Marketplace.
Okay, and Elaine, if you could introduce yourself, followed by Ken.
Elaine Knobs, sorry, my video now isn't working. Elaine Knobs C. Schultz, community member of the CAC and Mosaic Medical Director of Strategy and Development.
Good afternoon, everyone. Ken Wilhelm, the Director of United Way of Central Oregon.
Okay, and Kristen, if you'd like to go ahead, followed by Mayra.
Kristen Tobias, and I am the Community Health Coordinator for Pacific Source.
I am Maida Benitez, Consumer Representative.
All right, and Rebecca and Regina.
Is it me, Rebecca Donnell?
Yes.
Okay. Good afternoon, everyone. I'm Rebecca Donnell. I'm an innovator agent with the Oregon Health Authority. Thanks for having me here today.
Hello, everyone. Regina Sanchez, Crook County Health Department, CAC member.
Okay, and Tom, if you'd like to go, and then Tricia.
Tom Kuhn, Community Health Manager with Deschutes County Health Services, Public Health, and the Deschutes Public Health Representative.
Good afternoon, everyone. I'm Tricia Wilder, the Director for Central Oregon for the CCO for Pacific Source.
Okay, Elizabeth, if you'd like to go, followed by Jolene and Connor.
You're on mute, Elizabeth.
I'm Elizabeth Schmidt, Consumer Representative for the CAC. And good morning.
Good morning. And Jolene?
Well, this is Jolene Green. I'm a consumer. Sorry, I joined late.
Okay, and Connor?
Hi, good afternoon, everyone. Connor Carlson, consumer rep for CAC.
All right, and now we'll do our staff, Michaela and Gwen.
Hi, everyone. Good afternoon. Michaela Arsenault, a project manager at the Central Oregon Health Council, and my pronouns are she, her, and hers.
Hi, Gwen Jones, she, her, hers, also a project manager. Happy Thursday.
And Donna and Kelly.
Good afternoon, everybody. Donna Mills. I serve as the Executive Director for the Central Oregon Health Council, and my pronouns are she, her, and hers.
Hi, everyone. Kelly Adams, she, her, and hers, admin services for the Health Council.
And Renee.
Hi, everyone. Renee Worth. I'm a project manager with the Central Oregon Health Council, and my pronouns are she, her, and hers.
And I'm Camille Smith. I'm the new administrative assistant at COHC, taking the place of our beloved Kelsey, whose last meeting this will be.
Hi, everybody. Kelsey Seymour for the last time, Administrative Assistant and Media Coordinator for the Central Oregon Health Council. My last day is on Monday. So this is actually my last committee meeting overall, and I'm happy to spend it with all of you.
Have I missed anybody? If I have, please speak up. All right, Michaela, over to you.
Thank you. And I'm actually going to pass it to Brad.
I'm muted. Thanks, Camille. Good job. Okay, I'm gonna ask for public comment one more time, just in case somebody joined us who does have public comment. Anybody? Anybody? Okay. Well, let's move on. Do we have a quorum now? I think we do.
Yes, we do.
Okay, great. Let's go ahead and would anybody like to either make a motion to approve the minutes, or are there any comments about the minutes before we do that? I'll actually start with a comment. There's the last two items make it sound like I'm doing all the work. I think one's about emerging issues, and the last one is, I think that's the main one. I just want to make it clear that it's not me doing all the emerging issues work. It's not me alone. As drafting process, so it's not just me. It's a small committee with Gwen and Michaela and who else has participated in that?
Linda and Mandy.
Linda and Mandy. Thank you.
Yeah.
So we can either name everybody or call it a committee, or I don't know. Just want to make that clear.
So Brad, this is Ken. I would move to approve the minutes and change that under emerging issues to say Brad is leading a process and is close to moving it forward, et cetera, et cetera. You only have to change a word there.
Okay. Is there a second? Is everybody happy with that? Assuming that everybody's happy with that, is there a second?
I'll second it.
Second.
I think Teresa jumped in there first, I think.
Yeah, it doesn't matter. But yeah, I'll take that.
Thank you. All right. Without any more conversation, those in favor, please say aye or yes.
Aye.
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 All right, and those opposed? Say no, opposed, whatever you'd like to say. Okay. Thanks, everybody. All right, so let's see. We had our combined board and CAC meeting on the 9th, last Thursday, I believe it was. And unfortunately, a lot of you couldn't join us. a lot of CAC members. But a few of you did. Please remind me who else was there. Just say I was there. Because I am having brain fog. Nobody here was there? Donna was there.
I was
I was
there.
there.
I was there.
Jean was there. Tom was there.
Put it in the
Christine was there.
chat.
All right. And I would say it was productive time. But I'd love to hear from those of you who were there. If you agree, disagree, feel free to just speak out. Kim, you're unmiked or unmuted.
I would agree. I thought it was a productive. I was pleased that the board would spend that much time on that subject, and they certainly seemed to. I think it was Elaine talked about an analogy about opening the door and going out on the porch, and I think that they really did that in terms of improving communication, which between our two groups, and that seemed to be the predominant feeling across the board.
I thought the meeting was really good also. I always enjoy those annual meetings with the board. And it was interesting that we had coinciding thoughts about what the group could do. It seems like everything CAC wanted to accomplish with the board and everything the board wanted to accomplish with CAC paralleled each other. So that showed that we were really in alignment with them. And me being the public health person, of course, I liked that preventive services should be brought a little more before the group in the future. And of course, I can help be a conduit to that, along with all the other public health counterparts that are members of this committee. So I thought that was really cool.
I thought in all my years of being on the CAC, I thought it was for sure the most honest and just open conversation that I've been ever seen in terms of how the board and the CAC work together and actually having focused time around that discussion versus my memory of our past annual meetings together were all about our certain subjects and what were we choosing as our focus area. So this to actually really have concentrated time to talk about the relationship and working together and how to better. And I felt like they were really authentically listening and wanting more conversation and making sure they're getting input from the CAC. So that felt for sure very heartwarming and like forward moving.
Anybody else want to share a comment?
I'd give kudos to all the people that planned it. It was well planned and executed. Getting the survey ahead of time so that we had identified kind of where folks landed and what they were, their perspectives. And so that and the facilitators moved us through, I thought productively.
I just wanted to mention that I will be having my debrief meeting with our facilitators, I believe on the 28th. Keep me honest, Camille. And we will actually have a report out with the notes and deliverables so that I can get that to you all so we can get started on the work together with the board. So I really appreciate all that we're able to be there.
Thanks, Donna. Yeah, so Michaela's brought up, you want to describe what you brought up here, Michaela?
Sure. So towards the end of the meeting, after the board and CAC's conversation, the board and the CAC came up with these action items that they would like to take together, or a list of them. And then we used a polling function to that everyone could use to rank which ones they felt were more of a priority. And this is where they landed.
Thank you. Yeah, so this gives you a good idea of, yeah, some of the ideas that were shared and where people stood or stand on each of those. So basically meeting more frequently. Pretty much everybody agreed that meeting once a year is not enough. So we'll be working together to figure out what that frequency will be. Increased frequency. CAC members owning patient stories. So this really came from the board. So the board, thought, I believe this came from the board, but they certainly agreed that it'd be great for CAC members to be the ones providing the patient story at the board meetings. So there's a culture on the Health Council board of having a patient story shared, kind of like where we have public comment, they have patient story. And typically it's been, at least in my experience, it's been a provider sharing either Pacific Source or St. Charles or one of the other providers and or insurers sharing the stories. And I think it was actually Regina who brought up that, we're Regina as being one example, but other CAC members as well who are working with, serving families and clients, OHP clients every day, have a multitude of stories that they could share. And yeah, it makes a lot of sense for those who are directly connected to the service, serving of the clients, be the ones to share the stories. So we're gonna work through how to do that, how to make that happen. Enhancing inclusion with increased quantity and quality of interactions. I think that's kind of the opening the door and going out on the porch that Kim brought up, that Elaine actually used as a metaphor. Just the idea that we just need to reach out to each other more, and that everybody was pretty much in agreement on the board that CAC members, they want CAC members to feel comfortable reaching out directly to a board member or any board member if you feel like you have a good reason to reach out to them directly, that they're open to that. So that was important to hear. Setting goals for board and CAC's relationship and evaluating every 6 months. So again, being really proactive and deliberate, intentional about how the board and CAC will work together and reviewing it as we go. Elaine's clarifying. She said we need to have community potlucks and invite each other over for dinner, metaphorically. Or not. It could actually happen in person, in real life. Thanks, Elaine. Having candid discussions regularly to take the pulse on the progress of CAC and board relations. Again, that's that increased frequency, I think. Covers that. Review board bylaws and CAC charter and discuss together. So yeah, really looking at our charter and the board's, I'm not sure if the bylaws, but the directives of the board and their strategic plan and so forth. And seeing where we align and how we can work together to carry the work forward. So it was very productive. Everybody seemed to appreciate the time together and the fact that we're really honing in on how we can work together better. And so I'm excited. Hopefully all of you are too, about where this is headed. And so as Donna said, there's going to be she's going to meet with the facilitators, the hired facilitators who kind of collected all the data and gonna make sense of it, and then help us create that plan with action steps. And so that's exciting. So thanks everybody who participated. And those of you who didn't, we hope you can and will next time. So with that, any other comments? So we just heard a lot and we're seeing a lot here. Any comments on what's on the screen? Questions?
I have a comment. I wasn't there because I couldn't do it, but I'm glad to see this because I was really close to just quitting. I'm so frustrated with the whole thing. So this is hopeful. So yeah, I was drafting a resignation. And so I'm glad that this is happening, and I hope it actually changes things for patient care. We'll see. I'm pessimistic. but we'll see. So prove me wrong.
Thank you, Teresa. Yeah, let's prove you wrong.
Yeah.
Thank you for hanging in there and not resigning. Really appreciate it. Any other questions or comment? I don't know. Are you seeing the chat, Teresa? I don't know if I should read it, but Gwen was thanking you for being so honest and open.
I usually close it because it's too much data at once for me. So, but I'll read it there. Cool.
Okay.
Thank you.
Anybody else before we move on? Questions, comments? All right. So the emergent issues process, Gwen is going to walk us through that.
Hello. So it is with nervous excitement that the small group is kicking off the emerging issues process that y'all have been working on for several months. And so what we're going to do for the next hour is just do a quick refresh of what we're talking about and why we started it. I'm going to show you an overview of the process and some of the tools that the small group created. And then we're actually going to work 2 of the items that have kind of been sitting on a list through the process. And when we walk through the process, I'll let you know it may feel really basic and foundational. But as we go through it, this is really about following the steps that we've built to really build muscle and familiarity with the process, gather information about the process and what's working and what's not working so we can change it as need to be. And so we don't forget anything and so we don't go astray because the process is a good place to start. So that's kind of what's ahead for the next hour or so. So I'm actually going to invite you all to offer up just a quick somebody daring and bold at the lunch hour on a Thursday to share what brought up the desire to address emerging issues and develop a process around it. Just 1 or 2 sentences from anybody. Say it. How did this need surface?
Anybody?
One or 2 sentences.
Yeah, just tell us, what do you remember about why we're even talking about this? You said it earlier in your statement, just articulate it. Just say it again.
I said, I think because for me personally, I think my viewpoint is we need to know exactly what's working and not working for clients in a day-to-day, just day-to-day, what's working, what's not, and why.
Nicely said. Thank you, Teresa. Yeah, and it's not just your solo opinion. It's the opinion of most of the folks, all the folks on this council, and recognizing that we needed a kind of a structured way to do that. So that there was that wraparound communication, accountability, follow through, and tracking of what's happening and where things are going. So we know what's happening.
Right.
Yeah. So that's where we're headed. So let's, Kelly, can you put the link to the Google document in the chat? So what we're going to do is give you a link. What we've done is in recognizing that this is your work, this is the CAC's creation and the CAC's process, staff created a Google folder for lots of CAC stuff that you can look at and go in and look at all the time. It doesn't necessarily belong to the Health Council, it's yours. So I'm going to walk through accessing that, and then we'll stay on the line after the meeting to do a little bit more tech support. But what you should be able to do, it'll be really easy if you have a Gmail account. You'll click on that link and you have access to go into a folder. So I'm going to do that, and then I'm going to start sharing. I'm going to share screen, and we're going to do it together and look at everything. So let me think of which screen I want to share. Y'all are going to see each other. It's going to be fun here. Okay. Can you see my full screen? Somebody nods. Thank you, Donna. Okay. So on the chat box, can you see my chat? I'm going to click on the link. It says link to Google file. And then you're going to come into your Google Drive, which is associated with your Gmail address. And I'm going to change screen shares so I can zoom in a little bit.
Oh, okay.
Okay, so hang tight. Okay. So then you should get a screen similar to this, but it'll be in my drive. So you'll have a bunch of stuff here that you may or may not know that you have if you're not in Google Drive yet. This document came to you from someplace else. So you're going to come to this shared with me folder if you need to. And you should end up in this Community Advisory Council folder. So give me a couple nods if you're on it. Okay, great. Thank you, Teresa. All right. So I'm going to show you what's in here and how it's organized, and we'll do this multiple times. Archived just means it's old stuff that we're not actively using, but we don't want to throw away yet. It's that file bin of, hey, we think we might need it sometime, so we're going to store it here until we cleanse the closet and do a huge purge. Okay, so you won't need to go in there. Then we have this other folder of all emerging issues, which is the process that we're going to be using. So it holds everything that we're going to need for this. And then we're going to start putting some other documents that y'all will be using and referencing in here as well. Right now, this CHP is actually the RIP. It's the generic term for a Regional Health Improvement Plan Progress Report, and your charter and the CAC charter. So if you want to refresh, hey, what are we all about? You can always click on this and look at that. For now, you're going to click, and I'm going to project the whole way. So if you're not able to, follow along on your computer, you can just follow along on your screen, and we can walk through it tech-wise later. So if you are with me at this point, you click on the Emerging Issues folder, and it'll open up, and you'll see kind of the string of how you got here up at the top, and then the documents inside it. This CAC Collaborate is the original slideshow that we started building from, that we worked off of for a multitude of meetings. So that's there. We have, I'm going to start at the bottom here. We have process steps and details. I'll open that in just a minute. Is going to show you the high level process steps and then the details of it. Imagine that. We have a tracker that will help keep track of where we are in the process, because we know we're going to get multiple issues, and we want to know what's happening where. So it'll be a place for us to record that and stay accountable. And then this OHA and PS support at a glance. This is the Oregon Health Authority and Pacific Source support at a glance. It's a tool that we'll use to figure out, who do we start talking to first, Pacific Source or OHA, or maybe it's both of them. So we'll go over that too.
Hey, Gwen, real quick.
Yes.
Since we have, I believe, Jolene on the phone, right? Just want to make sure this was all in the packet, correct?
Yes, most parts of it, the process steps are in the packet. A screenshot of the emerging issues tracker is also in the packet. And I'm trying to remember what else, Michaela, was it the charter? Also, so, yeah. Okay, thanks. Okay. Yeah. Thanks, Brad. And stop me because everybody's faces compress. I can't see. So please interrupt or just start talking. It's never interrupting. So, all right. Okay. So let's take a look at the process. So you can click on that document and you can pull up process steps and details. And it's going to take a little bit to load.
Mine gave me an authorization error.
Okay. Can you chat and we'll figure that out? We did some moving around and we were playing with new things, so we could have visibility and different folks had access to actually changing stuff. So anybody else having authorization errors, not being able to get in? Okay. Try it one more time. And then we'll follow up and see what needs to be done, okay? All right, so it opens up to process steps and details. So this is the high level process. I think we shared this with you in like really brief a couple meetings ago. This is kind of the high level process that the group developed, and in that obviously an issue is going to come up. We need information about it, and then folks are going to review the information and decide, reflect on it. So we need to know what's going on and have a shared understanding, get more information. And then the group will decide what we're going to do and how we're going to do it, then take the action and then track and monitor. And of course, it's going to be kind of repetitive because as you get more information, it's going to direct your actions. This is much more in detail, and this is what we'll be going step by step through today. On the left, you see the step as it relates to the little circle up above. So an issue emerges. Who could it come from or who's addressing it? Some of the questions that'll be asked, and these are questions that CAC members developed to help guide the discussion and the decision, and the tool that might be helpful in identifying the answers to those. So we'll walk through this. So an issue comes up, and it can come up, anybody, a CAC member bringing it up during the CAC meeting. Basic information, what's the issue? Is it within the CAC scope? To tell whether it's within the scope, we're gonna pull up the charter and take a look at the charter. We're gonna gather information, and this could be from the subgroup or staff. Things that we're gonna look at is grievance and appeal data, who's impacted, their experiences, what's happening in other areas. And then on the far right, some of the tools that'll help us are the charter that I need to rename this. Sorry, this is the Pacific Source and OHA at a glance, support at a glance document. And then our emerging issues tracker. And then we'll pull up that information, review that information. It'll be either the whole CAC or a subgroup that then reports to CAC, address some questions and do a little thinking on that. Reflect how it lines up with the values, responsivity, consistency of care. And then the whole CAC will decide, should we address it? Why or why not? What's the next step? What are the other things pressing on us at this time to consider? And then some action will be taken and it'll be assigned to somebody. And that will be identified on the tracker, and we'll keep building that into the tracking and monitoring will be part of our ongoing agenda for CAC as we move forward. If not every month, probably every 2 months based on a lot of the other CCO requirements like the grants stuff, and making sure folks have the information that we need before they come to you. So those are the process steps. What we're going to do is go back up at the top. You'll find your tab that goes back to the emerging issues folder. And I'll show you, we'll look at the tracker. So we'll click on this emerging issues tracker. And it'll take a minute to open up. And what you'll see here is a spreadsheet. The way it's been built is that this first page is a summary. So it's a one page glance of what's happening. Behind this is, yep, all the details. So this will be where the staff adds all the detailed information about what's happening, and any additional notes, and all of it will automatically populate up to this one page summary to see where things are at. And so you can see we've got access to periodontal care, chiropractic services, and these are the ones that we're going to go through today and get a little bit more information about and move into this gathering information and facts. Any questions about those two so far? All right, then the last document, you'll go back to the tab that says emerging issues at the top of your screen. And we'll click on the OHA and Pacific Source Support at a Glance document. And this is a document that your OHA liaison and Pacific Source Health Coordinator created, and we kind of combined their information. So thank you so much, Rebecca and Kristen, for creating this. I'll let you review this at your leisure, but it spells out specifically what Rebecca's role is in this first paragraph, specifically what Kristen's role is. And then the next 6 pages are just a wealth of enlightenment. It talks about what might the issue be, some concrete examples, which I found really helpful, and then who would be the contact through OHA or Pacific Source in these last 2 columns. So this is a super helpful document that I encourage you to look through and get to know after the meeting. All right. How's everybody doing? Are you still awake? Teresa, Regina, Myra, thumbs up. Okay, good. All right, thank you. Yes,
this
go
is
ahead.
Rebecca. I'd just like to add that if you have a question or an emerging issue that you don't see captured, but you believe that it's a question for Oregon Health Authority or Pacific Source as the CCO, that's totally possible that we didn't anticipate every issue or question, or we tried to think about as many categories as we possibly could. So feel free to reach out if you feel like, well, there's not a category on there for my question. That's okay, we might have missed it. And so we can add that on and figure out who you need to talk to or who we need to talk to.
Thank you. Thanks, Rebecca. Yeah, the seems super comprehensive, but we know something will come up and we'll figure that out together. So, all right. So let's move on. Let's do this. So everybody get ready for some thinking. What I'm gonna move chat over here. I'm gonna share screen again. And what I've done is I've put the process steps next to the tracker, but you can't see that yet because that's not what I'm sharing. Let me try that again. All right. Okay. So on your screen, on your left, you'll see the process details. On the right, you'll see the emerging issues tracker. So back in November of last year, Teresa, you brought up the access to periodontal care. We know there was a lot of conversation both in the meeting, and there was some offline conversations with Kristen. Since then, with the start of this process, We populated it to the tracker, obviously. And you can see if we look at our process details, the issue emerged. We've identified that it is within the scope because it's dental care. And so that's our first step, right? So the second step is gather information. So we took the liberty to start this into the process and asked Kristen to come share what information they do have, Pacific Source has from the Grievances and Appeals around periodontal care. So she's going to do just share a little bit of information, and then we're going to kind of walk through these questions just one at a time. Okay.
Okay.
Okay. And then we'll review it and reflect and come up with the next action step. So I'm going to stop share for a minute. Well, for a little bit more than a minute. And encourage Kristen. First of all, I actually realized I had to do a little research. I am going to about what periodontal care is. So is that like a basic place to start?
Yeah, I mean, I can tell you the whole, just let me preface this as that here in Central Oregon, dental care of any time sucks. So of any kind, periodontist care is periodontal. If care is when your gums recede beyond a certain depth, then you have pockets and your bone deteriorates and you lose teeth, basically, as it progresses. You have to stay on top of it with maintenance, which is basically a certain type of cleaning to keep it from getting worse. But I also want to throw out, if I can, I've learned since then that like general dental care, if it's really hard to get, because I can't get a periodontist and I have to settle for a general dental dentist. Sorry, I'm rambling. But I've also learned that if you're OHP and you have healthy teeth and gums, you only get to see a dentist for cleaning once a year, where for years it's been said you should do it generally every 6 months. So anyway, I'm throwing that out there because you're listening to me. So periodontal care is taking care of those pockets to keep them from, because they'll change. They'll get deeper, 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 or they'll get better, 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 depending upon your care. That's what it is.
Thank you, Teresa. That's super helpful to understand. I also did like a super in-depth, not so much, Google search and came up with some information from a couple of websites. So that's in the chat for folks who like to read as well. All right, now, Kristen, it is your turn and I will stop. Share away.
If I'm totally honest, I didn't realize I was sharing right now, but that's okay. So I'm just going to pull up really quickly the agenda that I actually had. Do you have the graph that shows? So I guess speaking a little bit more to the periodontal stuff, we are still working on collecting that information. Jessica, who came to the CAC earlier this year, was going to reach out to the DCOs to see if they collect grievance and appeal. Oh, yes, Teresa.
No, go on.
Oh, I'm sorry. She was going to reach out to the DCOs directly to see if they keep that data, the grievance and appeal data. And part of the reason that they may not is because periodontal services aren't a covered benefit under OHP.
So I would throw out a question as a member. How come it's not covered under OHP? That's what you're told, but they're willing to cover it if you go to Salem. That doesn't make sense to me.
I'm not 100% sure on that, but if I recall, it has to do like they would have allowed like a one-time exam and then it would have been approved every single time. And Rebecca, maybe you can speak to this too, but that's an agreement between the DCO and the periodontal provider. and then they bill that as fee for service. Rebecca, am I kind of correct with that?
Yeah, I'll need to take this back and do a little research specific to this question. Gwen, if we could capture that and send it to me, and then I'll make sure I get 100% accurate information to provide back about that benefit. I did also just, this is not going to solve the question about this particular issue today, but I did share the next meeting of the Oral Health Advisory Panel meeting, which is on October 6th. They host regular meetings, and there is a public comment period. You have to sign up in advance, and I included the link for that. But if you ever want to make public comment and have that advisory council, which makes the determinations around OHP dental benefits, aware of the issue that you're concerned about, and B, to be able to get response from that group, that's an option as well. But I'm more than happy to take this question and get specifics and bring it back.
All right, thank you. So I'm going to pause. I'm going to pause the conversation just for a minute to catch up with the process.
Okay.
I'm going to ask somebody, Michaela or Kelly in the tracker, could you open it up into the details and update the request submitted and gather information piece? And I'm going to project so we can see that because we can follow along real time.
Okay.
So Gwen, what did you want updated? Sorry.
No, that's okay. Go to the details section of the tracker, and under gather information, request submitted, data provided by, do a drop down, and we're going to Rebecca's going to take that, so we're going to change that to OHA.
Got it.
And then I'm going to ask Rebecca. So the question, get some clarity on what we're asking from OHA is around why it's not covered. Is that what I'm hearing?
Yeah, part of it should be why it's not covered.
Absolutely.
Because if you need that kind of cleaning, no one goes, yeah, I want to be in that position, but it should be covered. But my question goes, and I'm wondering if in this scope of things, if we could, as a CAC group, look beyond just periodontist work and into complete dental care, because it's ridiculous here in Central Oregon. I had to switch providers. It took months because of stupid stuff, and you're welcome to call me and I'll give you the whole story. But I can't get in to see the dentist for an initial consultation till January. You know, and I've heard, oh, we're working on it. No offense to anybody, for 3 years. So that doesn't, that tells me, and I'm sure a lot of other people, it's just like, I feel like it doesn't matter,
So let's, Kelly, can you add on to the next line under that, access to dental care? And I think we actually, so that'll be in line. And Kristen, I think you have information. We may be able to share that today, but let's focus on the periodontal piece right now, and then we'll add larger dental just because we have another item in line for now.
Okay.
Okay.
Cool. Okay.
All right.
So why isn't it covered? Why do you have to travel? Why will maybe periodontist not take on clients? I mean, that would be here, because there's like I don't know, 15, 16 in Central Oregon periodontists. So,
and then I think the other thing that would be helpful too is the answer to those whys, but also, I don't know if that's the answer already, but what would be the avenue for advocating for changes to that?
Good.
So we'll look to you, to Rebecca, and I'm thinking this, the advisory panel is one of those avenues. So Teresa, or anyone else, if there's folks interested in making a comment or scheduling a comment, staff would be happy to help you with that as a community member. Okay, I got two hands. Hold on, Rebecca and then Michaela.
And I know we're working through the process for emerging issues today versus solving the questions are specific to dental care today, but I did just want to share, and I shared this with the Health Council team, but the Health Evidence Review Commission, also called the HERC, short for short, there's an opening for a dental seat, and that is the group of clinicians that reviews evidence, medical evidence, dental evidence around effective treatments to decide what are effective treatments to include in the Oregon Health Plan benefits. And so there's an opening for a dental seat, and nominations or applications for that are open through September 20th. So we're coming up on the limit for the application process. So I just wanted to make one last plug here today. If you're in community settings where there might be a dental provider, a public health dentist who would be interested in serving in that capacity, that opening begins, service on that commission would begin in January. So I'm just making one last plug. I'll put the information in the chat. That is the decision-making body for what benefits are covered, both medical and dental benefits for the Oregon Health Plan.
Okay. So even though none of us, because none of us are DCOs, could sit on it, that would be a body to both advocate to and then find somebody local to sit on that could advocate within the body.
Yeah, and it's a statewide advisory council or advisory commission.
Okay.
So I recognize that this group probably doesn't have a representative to send there, but I'm just letting you know, one, what that group is, two, that there is this opening for representation, and then three, if within the community settings that you all are in, you know of a dentist who might be a good candidate or have interest in serving in that capacity, share this information.
Rebecca, Brad has a question in the chat around if you know, if off the top of your head, if there's a Central Oregon dentist that's already sitting on that committee. And then Myra, I see your comment. I want to come back to that too. So.
Brad, I do not believe that there is currently.
Okay. Thank you. And then Myra, you had a comment in the chat. Would you be willing to speak to that?
Yes. So my comment was, again, with the periodontal, I don't know very much about it, but as Teresa was saying, you know, Oregon Health Plan only covers once a year for an adult to get cleanings. If they were to cover more preventative services, would that eventually prevent from needing services that aren't covered by Oregon Health Plan? And I think Linda was trying to answer that as I was trying to read her comment.
Yeah. Excellent. Thank you, everyone. Great conversation. So Kelly, I'm going to check in with you. You've updated Rebecca, that we've updated the tracker. Question for you, Rebecca, what's the time frame that would be reasonable for you to be able to come back with some of the information that the group is seeking? Oh, you're muted. You're there you go.
Yeah,
you were muted.
Yeah. I think by the next meeting, so I should be able to share back with the Health Council some information in preparation for the next meeting. And I may not have all of the answers, but I'll do my best. But I should make some progress by the time we meet next time.
Okay, thank you. And Michaela, thank you for your tap. I apologize.
Yeah. This is in regards to the HERC, the Health Evidence Review Commission. I think it'd be great if some CAC members wanted to provide public comment. But I think as we explore this further, it might be more impactful for the CAC as a body to advocate to the group.
To which group?
The HERC.
Yeah. So let's put that as a, we'll capture that from the notes today, the minutes, and look at that as a possible action to take as we gather more information. Sounds great. So we go through the process.
Yeah, I mean, I think that's key, is getting someone to hear what we know who can make a change. Because, you know, it's like we all feel, well, we're looking, but it doesn't help the people who aren't getting the services. I mean, by the time, again, I get my teeth cleaning, I'm over a year out, and I keep telling them, I'm just going to get worse. I'm just going to get worse. And it keeps happening. It's like, it takes so long to get a general cleaning that I then have to have a deep rooting, and I have to jump all these hoops to get it or get no care. And if I was just like everybody else, if we were just kept on track of going to the dentist with our preventative care, we wouldn't have the problems we have to the extent that we have.
Agreed.
And I know there's thousands of us. I know it.
Yeah, no, absolutely, Teresa. So we're going to pull you in to be a core part of what, you know, directing whatever action that the CAC wants to take moving forward. So you'll be a key part in that. So thank you. I saw Brad raise his hand, and then after that, I'd like us to, I think we're at the point to transition to the next issue. If we're agreeable to move on, that we're at a state where we're waiting for information. Okay, so Brad, go for it.
Thanks, Rebecca. Rebecca's letting us know she needs to go.
Okay.
Is there a dental provider? Is there any dentist representation on the board, the Health Council board? I'm not aware that there is. Is there?
Yes, there is. Dr. Gary Allen.
Advantage.
Okay,
And he
great.
is aware of the opening. He also sits on our provider engagement panel. We get our HERC reports every month, so he is aware.
Okay.
Oh, good. Okay.
So that may be another avenue as well.
Yeah.
Some connection there.
Yeah.
Okay. All right. Thank you, everyone. So let's take a process. All right. I'm going to share my screen. Let's look at our process details here. Not that one. Here. Let's see. Okay. So we're kind of wrapping it up at this time for periodontal care, because we're gathering information, and then we're expecting to get it back and review and do some reflection on it, if not getting to decision next month, depending on the CBI review requirements and our timing with that. So that'll be up at the next agenda item. All right, which brings us to chiropractic services. So Brad, would you share a little bit about what the issue is? And then we're going to ask the question, is chiropractic services within CAC scope?
Yes. Yeah, so I took my son. My son did something to his back. He injured his back, or had pain in his back and hip kind of. And I've gone to chiropractors for off and on for years and found them to be exceedingly helpful at relieving pain and just getting the body back in, the structure back in place. And particularly for an auto accident I had way back in the past that started to cause some kind kind of upper spinal issues, which are going down my arm, a numb arm, and things like that. And they fixed it over about probably 6 appointments, something like that. And just the fact that chiropractic is so affordable relative to other types of care as a preventive, both preventive and, actually addressing an acute issue that you might have. I don't understand. I guess it hasn't been included under OHP, but in talking to the provider, this is Natural Approach Chiropractic in Bend. It's a husband and wife team. The husband's a chiropractor, the wife is the administrator, and she let me know that she's been the one in communication with OHP and or OHA. I don't know exactly who she talks to. And according to her, for about 3 years, either OHA or Pacific Source, whoever, has been saying that chiropractic is going to be covered, but they haven't actually been, when claims are submitted, they haven't been paying those claims. And it's been off and on, and she just keeps being told that yes, it's going to happen, we're working on it, and it's just taking a long time. And so anyways, that's why I brought the issue. I believe it's definitely very useful and effective, both preventive and whatever the other word is for treating an actual issue you have in the moment. Service, and it's low cost, especially relative to other types of treatment. And so that's why I brought it forward.
Thank
It should
you.
be covered. Yeah.
Okay.
Cost effective.
Let's pull up our charter process step here and see if, for the sake of asking the question, does chiropractor care fall within our charter? And I'm going to look to you all to review the charter and answer that.
And if you want to enter into the chat your response, yes, no, that would probably work well.
Or maybe a question, does it possibly fit under this? Or what does this number mean on our charter? Any of that's good. Brad says he thinks so. Brad, tell us where you see it, where it falls into the charter. I'm not disagreeing. I'm just helping us look at our charter.
Yeah. Thanks. Well, my summary of the key points, especially in that first paragraph, is really what provides the guidance, and then there's some detail below that. But ensuring that the health council remains responsive to consumers and community health needs, I think it falls under that. Enable consumers to take an active role in improving their health, family, and community, I think it falls under that. It's OHP related, Medicaid related, so.
What do other folks think? Yay, nay? Does that seem logical? Thumbs up, do a diddy. All right, I got 1 thumbs up. I got 2 thumbs up. I got a yes. Okay, thank you all. Good. Okay, nice. So, so it's within the scope. And the next step is gathering information. And if we look over here onto the tracker, we see that, staff were on their game. And we happened to ask Kristen if she had anything. Kristen, I totally apologize for not actually asking you to be prepared because you did share the stuff out with us. Would you be willing to share what you know, and then we can kind of identify next steps from there?
Okay, just to make sure I understand, share what I know about chiropractic appeals that we've received.
Yes, what are some of the grievance and appeals information? Because that's like, what does the grievance and appeal data tell us about chiropractic service access reimbursement?
So I can say we received no grievances, so no complaints about chiropractic services this year. We received 36 appeals made by a professional. So whoever the provider is that referred for services appealed the decision to not cover the appointments typically. And then we received 3 appeals by our members. And this is all should be in the CAC packet as well on pages, oh, how come I can't see the page number? Oh, I'm sorry, 13. Yep, there we go. So, shoot, now I don't have my key that I sent you guys. Dismissed means that the appeal was either untimely or the member, or actually in this case, the provider withdrew it. A partial reversal, it typically around chiropractic services means that maybe 6 visits were covered and then the plan agreed to pay for 12. So that would be a partial reversal. A reversal would mean that the member or provider received everything they asked for in the appeal. So unlimited visits, 30 visits, whatever the appeal may have said. And then upheld meant that the original denial was upheld. And so when I looked at this information, I thought what really stood out was that clearly the members have the hardest time appealing a decision and winning that appeal. But our providers typically are successful in their appeals.
I'm going to open it.
Not typically, I shouldn't say that. They're more successful in their appeals. Sorry, I want to correct my phrasing on that.
Just because we haven't talked about grievance and appeals stuff and that language is like new to a lot of us, I want to give a chance for CAC members to ask questions. It's like, can you repeat that again or clarify this or that or the other, because it is so foreign.
So I have a question, Kristen. So how on the outside of appeals and grievances and appeals, how many people received chiropractic services?
I would have to ask for that number, but I can get that for sure.
Because it just makes me wonder, is the provider misinformed? Are they just not, I mean, it seems like there's either a disconnect in communication and information between the provider and whoever it is, again, OHP or OHA or Civic Source, I don't know. But anyways, I think it would tell a lot to see how many people are actually getting supported in their chiropractic care by OHP.
Or I mean, isn't it easy? I don't know. I guess everything sounds easier, but actually covering those services, and instead of making all of our clients have to appeal and grieve just to get the services covered. I mean, these kind of services will help them in the long run, not ask for painkillers, via an MRI, things like that. It just makes no sense for them to have to avenue all that just to get something covered.
And I would add to that, that if we know that providers are more successful than members in their appeals, it causes me to question why that is. And what about is our appeal process clear and easy to implement by a member, or are there other barriers to accessing an appeal process?
When I received and looked at this information, Linda, I had kind of similar questions, that none of our members had their appeal. None of our members won their appeal. And why is that? So when I looked at this, that was sort of my biggest takeaway. And then Regina, as far as chiropractic services being covered, the way Medicaid and OHP works, there's sort of a line, and a service is either above or below the line, and the OHA sets that line. So unfortunately, Rebecca had to hop off, but the CCO is somewhat hamstrung by what the OHA determines that line is.
Yeah, it's just too bad because if you look at it in other directions, just along with like when I had mentioned something about wisdom teeth, you know, that they have these people and they're handing out, you know, pain medication left and right. And so then later on, instead of just having that one problem, we have mental health, we have drug abuse, we have all these things, and it just costs us more money. Because that's what they're getting. There's like, oh, you're in pain. Okay, here you go. Come back again later and I'll refill it, or however it may be. So I don't know. I guess it's just frustrating.
Endless ER visits for dental blocks. I came from the ER, so I remember, and it goes back to dental access as well. And it just is a cycle.
It is. And then after they've given them so much, they go into the ER and then they're like, red flag, he's addicted. Well, gee, I wonder why.
Good, super enlightening conversation. Brad, you had a comment, and then we have about 5 minutes left. So I want to tie up what we're asking Kristen, what information we'd like Kristen to come back with, and what information we're going to ask Rebecca to come back with. So Brad, go ahead and make your comment, and then we're.
Thanks, Gwen. Yeah, no, I think we're seeing a light bulb go off that there's a role for the CAC in terms of advocacy. And I personally went through the appeals process and was denied for a service for my son. And I can tell you it's not easy. There's a lot of paperwork and trying to understand terminology, and so yeah, I think we could probably do a little bit of advocacy work in that arena as well.
Thank you. All right, so let's I want to hear somebody or a couple folks, what are the couple of things that we were asking Kristen to come back with, and then was why do we know why there's better success for appeals rather than member appeals? I remember that one. What else?
The other piece of information I'm going to track down is how many members are actually seeing a chiropractor. So I'm hoping I can kind of figure that out by members instead of claims, because I imagine some members could have a lot of those claims. So I'm going to try to get some accurate member numbers that are accessing chiropractic services.
Okay, thank you, Kristen. And then the question for Rebecca with OHA, who sets the line and what's reimbursed? What was the question for her?
I think just kind of a question around, what is above and below the line for chiropractic services? So I know like in some situations, back pain could be covered. In some situations, tobacco cessation could be covered, but not always. So maybe there could be a better explanation about what is covered, what is above and below the line covered versus not covered.
Yeah. Okay. And then okay, so we'll start there. Thank you, Kelly, for taking notes. Thank you for scribbling away.
I'll really quickly also say, just to speak to Myra's comment in the chat, we could always have Jessica Waltman would come back anytime to talk about the appeals process. So if that would be something that the CAC would like to see, and there's time on an agenda in the future, I'm happy to ask Jessica and her team to come back, and I'm sure they could walk through the appeals process and answer any questions at a much higher level than I can.
Well, and thank you, Kristen, for that offer. And I think what we may do is actually add that onto our list of emerging issues, is looking at the grievance and appeals from the member experience, from the member perspective, both walking through it and perhaps informing on it. So I'll trust Kelly to get that in there between the live or the recording notes that she's taking. So, all right. So we're going to wrap this up so we can shift to the last agenda item. Thank you, everyone. Linda, you made a comment in the chat. Would you share that for us and I'm welcome any other closing comments before we shift over to the next step, next item.
Even though we were supposed to be focused on process and not necessarily the nuts and bolts of the issue, I found it a really enlightening process, really energizing. I've learned a lot. I think I'm really happy at the broad exchange and conversation of information and member experience. And I feel like it's really creating possibilities for advocacy, for us to really be doing what our mission is. So I've enjoyed it and I think it's valuable.
And I see a couple other nods going, so that's great to hear. That's what we want. That's what we're aiming for. So thank you all for building it and walking the journey. I'll let y'all catch Brad's chat in the chat, comment in the chat, and I'm going to transition it back to Kristen because we're going to talk about flexible services. Thank you, Kristen.
Real quick, Gwen. So our plan is to follow up at each CAC meeting, correct?
Yeah, I think what I recall from the planning meetings, we're having monthly with the chair and co-chair is that it's going to be built into the agenda. There will be some months where there's some deadline items that'll have to take priority. For example, the community health projects, the grant review and decision making will probably take most of a meeting, if not two. And so this would come second because we have that deadline. But the agreement and the consensus from you all was that this is built into a regular occurring agenda item every month. So that's what we aim to do. So y'all keep us accountable, keep us all accountable, okay? All right, thanks, Brad.
Okay, so we're going to talk just a quick update on flexible services. You guys have been waiting a while to hear more. Next slide, please. Okay, so health-related services are used to pay for things, individual member items that OHP can't pay for and that K-Plan can't pay for. And just to kind of let you know, K-Plan is funded through the state. It might be like a wheelchair ramp, it might be grab bars, it might be smoke detectors or carbon monoxide monitors, things like that that'll help keep somebody in their home. So those are the things that K-Plan covers. Typically, the things I've seen the most are definitely wheelchair ramps and accessibility type devices. Next slide, please. So our 2021 Flex Fund starting budget was $110,000 this year, and that was a 10% increase from our 2020 budget. Let's see, but we've run out of funds this year, which I mentioned last month as well. The budget had been pretty static year after year. So the 10% increase for 2021 was actually a pretty big increase for Central Oregon, but we also saw a really sharp increase in COVID-related needs, largely housing, emergency housing type supports, putting members in a hotel for quarantine and things like that. So we spent our budget a lot quicker than we have in the previous years. So we're reevaluating. I actually think this month is budget discussions to hopefully increase our Flex Fund budget in 2022 again. Next slide, please. So some of the ways we're letting our members and providers know that we're out of flexible service dollars is by email, phone. So if we were to receive a flexible services request, one of our flexible service team members is going to pick up the phone and make a phone call and try to either connect with that provider or member. We're also sending denial letters. That's just, it's an OHA requirement that we send a denial letter if we're not able to pay a flexible service request. And then trying to make announcements at community meetings like this. Next slide, please. So here's just a small amount of examples of some of the things that flexible services covered this year. In addition to this list, we paid for medication minders, nutrition shakes, replacement IDs, shoes, mattress toppers, wheelchair repair fees, step stool with handles, bathroom scales, locking pill dispensers, blue light glasses, helmets, gait belts. which are belts you might use if somebody needs some help with ambulatory stuff, moving from like a wheelchair to the bathroom or something. So that's just a short list then. Next slide, please. So this is sort of a breakdown of how what members requested. So health promotion items, which would be again like weighted blankets, things like that. Gym memberships, health activities. So that might include like a club or maybe to pay for youth members football or something like that. Exercise equipment, education. So we paid for things like ABC Mouse and some other type of like tutoring or education supports for kids, especially when we were doing remote learning. Transportation. So we have paid to fix people's cars and things like that, so they have transportation to get to an appointment or to work or the grocery store. And then you'll see that the largest share of where funding went this year was to shelter and housing. Next slide, please. So this is again another breakdown of who made requests for flexible services. Mosaic Medical asked for the most. And then Central Oregon Pediatrics Associates, Bethlehem Inn, we have an agreement with them where they sort of submit $100 for our members that are staying with them and they're at the Bethlehem Inn. And they can submit a claim for $100 to help defray the cost of having them stay at the shelter to help keep some sustainability for Bethlehem Inn. I was hoping to break this down by clinic location so we could sort of have a better idea of where people are asking for flexible service help. But unfortunately, with so many of our traditional health workers and community health workers working remotely this year, the way that some of our larger clinics set that process up was it would, if a member asked for a flexible service item, because they all have to be signed by a provider, for example, it was like going into like a queue in Epic, which is the medical record. So a community health worker in Mosaic Bend may have submitted a request for a Mosaic Madras patient. So we weren't able to really discern which clinic was asking for funds this year, but we're hoping to collect this information more specifically by clinic. And we're also exploring if there's a way to collect this information so we can look more at like the member demographics for who's asking for help. So we're working on that now. I think that was it. And then the budget, how is the budget determined? Leslie, no, I'm kidding. That I would have to ask specifically about that, but it's part of our health related service budget. Donna actually might be able to talk about that. I don't know. Maybe that's separate from CBI.
Yeah, it is separate, completely separate. And I don't even want to go down that road because I could be totally wrong. I'd rather that we get it directly from the civic source.
Yeah, and I could share it's come up in a recent budgeting meeting that we'll be reviewing internally and hopefully adjusting in positive ways going forward. The other health councils as well just started with a budget similar to ours over the last year. So it's been interesting to watch how much the resources are being utilized, and the fact that we ran out early is good for next year, meaning we hope to increase that budget, and I can certainly help provide that information to Kristen to report back once we're through that budgeting process internally.
Great. Thank you, Kristen and Tricia. All right, any questions or comments?
I have a question.
Yes.
So, Kristen, so if you're in need of something, does your provider say, oh yeah, you're like, you need this, and you go, well, I can't afford it, and they go, oh, we have these flex funds, and then they refer you? Is that how people get things? Or people Go on.
So there's kind of a variety of ways. So maybe a provider says, maybe we have a member that fell off of a stool. So then the provider says, you know, you're going to have to get up on a stool to get this down. So we'd prefer to have a stool with handles, or, you know, so you can hang on. So maybe the member can't afford that. So then the provider could submit a form, a flexible services request form, to Pacific Source. And what we would ask for is for them to kind of explain the reason why the member requires the item and the cost of the item and sort of which stool they want us to purchase. And then our flexible services team, which is part of our member support specialist team, reviews all of the requests and then they approve or deny it. And if it's approved, then Pacific Source would just have that item shipped either to the provider or to the member.
Okay.
So some of the other popular things that we'll cover are gym memberships. So with gym memberships, a lot of times the members will apply for that themselves and then just ask the provider to sign off on it. Because a gym membership, it's pretty easy to say, we're all healthier if we exercise regularly. So, but you have to get on it early in the year, apparently, because we did run out of funds very quickly this year.
Thanks, Kristen, and thanks, Teresa, for your question. Well, to honor everybody's time, I think we're gonna go ahead and wrap it up. If you have other questions, reach out to Kristen directly about those flex funds. And thanks, everybody. Good meeting, I think.
Great meeting, everyone.
Yeah.
Thank you.
Take care. We'll be in touch.
Bye.